Welcome back, everybody, to episode 4 of Implementation Science 101. My name is Ruben Martinez. I'm an implementation scientist and clinical psychologist at Brown University. Today, we're going to be talking about implementation outcomes and why we should care about them. So I'm going to do a quick review. We're going to do a little case study to set the stage, and then we're going to go through what implementation outcomes are. As a reminder, in implementation science, we have a thing. That thing is a practice, a policy, a procedure, a curriculum, a treatment, you name it. Anything that you can implement, that's what we're studying. In health research, we have what's called efficacy and effectiveness research, which is clinical research, where we're focused on best understanding, does this thing help with the clinical effects that it's supposed to help with, the clinical problem. So if we're going to talk about cognitive behavioral therapy for depression today, does cognitive behavioral therapy for depression help with depression? It's just a really easy example. On the other hand, implementation research focuses on what are the ways that we can help people do the thing in the best way possible. I had a little bit of a blurb last time about implementation strategies and what they are. I'm going to have a whole episode on them, so I'm not going to go into a lot of detail, but these are things like training, audit and feedback, designing workflows, just stuff we do to help people do the thing in the best way possible. We can't just put things into a system and expect for them to work. We have to do something typically to help people use these things efficiently and with quality and well over time. And one of the core pieces of implementation science is then that if we're looking at how effective our strategies are, things like training, we have to also look at what outcomes those strategies might impact. And so those are our implementation outcomes. It's how much and how well people are doing the thing typically. So we're going to start really quickly with just a case study, and this is going to follow us through. So in this case, our thing is cognitive behavioral therapy for depression. We're going to shorten that to CBT so I don't have to say it 30 times. A context is we're implementing this into a community mental health clinic, and we're doing a couple different things for our implementation strategy. We're doing a one-time training and monthly consultation with therapists. We're providing incentives for demonstrating, for the therapist demonstrating that they did CBT in their documentation. And we're also including a nudge or a reminder in the electronic health record system to remind clinicians to do CBT. So, how is this relevant to our outcome? So this is our strategy, right? This is what we're doing to help people do the thing. Now we want to know what impact these strategies have had. So this is Enola Proctor and colleagues' model for implementation outcomes. And this was developed in 2011, and it's very widely used today. And there are 8 implementation outcomes in this model. So the first one is acceptability. So for instance, we might go in and we might look at how acceptable is CBT for our clinicians? Do they actually like it? Do they find it palatable? It's another way to think about it. We might look at how much they have adopted CBT, right? So have our strategies impacted the rate of adoption? Or we might look at what are the decisions they're making, or how are they making decisions to adopt CBT? We might look at whether CBT is appropriate for the context. Sometimes people want to implement things into contexts where they just don't quite fit. And an example of that is when people want to put really complex treatment protocols or treatments into schools. Schools are places where you have a lot of short contacts with people and you don't have a long time to do any one thing or another. And so we have to think about how appropriate things are. How feasible is CBT to do in this clinic? Fidelity is a word I don't love, but the idea of it is very important, which is that our therapists doing CBT as it was intended to be done. So there's a lot of work done around how people say that they do CBT, but actually they don't do CBT. And I've seen this both in my personal life and professional life. So fidelity really refers to, are we helping people do CBT as it was intended to be done? We might look at how much CBT cost or how much it saved over time. We might look at things like penetration or reach, and that's really looking at how deep into the organization has CBT actually penetrated, meaning is it widespread and being used across lots of clinical teams and lots of people, or is it sort of isolated in one group of people who's really picked it up and run with it, but not everyone is using it? Probably most importantly, we should be interested in things like sustainability and sustainment. And this really refers to how much is the CBT done over time. And sustainability might be asking clinicians to tell us how sustainable do you think this will be for you in the long term, while sustainment is looking backwards and measuring how much they actually did CBT over time. So there's a slight distinction there, but it is important. I'm going to show you this next model, which is called the re-aim model. This model, you'll see a lot of overlap because it's really similar, and these implementation outcomes are very similar across the models. They're not exactly the same, but they are similar. So re-aim stands for reach, effectiveness, adoption, implementation, and maintenance. So penetration and reach are sometimes thought of as the same thing. Re-aim really thinks about reach as, are you getting to the people? Is the thing getting to the people it was intended to? And if not, why not? Who are the people not getting the thing? And what are the reasons for that? Effectiveness really looks at the clinical effectiveness. So we're interested in that, the efficacy and effectiveness questions that we talked about earlier. So how effective was CBT in helping depression? Adoption would ask the question, as we said before, how much is this thing adopted? And what are the ways that people are deciding to adopt it or not? Implementation typically focuses on fidelity. So how was CBT done in practice? Were people faithful to the model? Again, you see why I maybe don't love that word, but you get it. Maintenance refers to, it's pretty similar to sustainability. So how much was CBT for depression sustained or maintained over time? So these are our two really big models. There's lots of other ways to think about implementation outcomes. I hope this has been a helpful primer. It's time now for our very, very fun fact. And the fun fact is that there is no right model for measuring implementation outcomes. There are models that you might be more or less familiar with or comfortable with. There's not one right way to do this. There are actually many right ways to do it. And sometimes there can be some dogma around that. I think there's also, we get these questions a lot around, do I have to measure all of these outcomes in one study? Typically not. Typically, we don't get to every single outcome in every study, and we may pick one or two primary outcomes to look at. It really just depends on your scope, your evaluation, and your approach. So don't feel as if you have to measure every single one. It's a lot of effort to do that. It's a lot, this can be very complicated. So thank you again for joining me today to learn a little bit more about implementation outcomes. If you have any questions, thoughts, critiques, please feel free to email us or to leave a comment in the comment section. I really appreciate your time and you coming back and watching this and learning with me again. I want to thank our sponsors, Advance RI CTR and the Bridge Program at Brown University. And I wanted to remind you to please keep bridging the gap and please keep coming back. I promise this page will keep getting better and more improved, and I'm working on it. It's hard to do on my free time, though. So I hope you all have a great day, and thank you for joining me.